Okay, so you've had your first DEXA scan and the results are in. This is what it looks like. DEXA breaks you up into bone, lean and fat. This is mass in kilograms, that's percent over there. In terms of fat, I use kilograms of fat as a way of judging where you're at and what progress you're making when you have further scans, because that's really the bit of interest. Percent fat is really your fat mass divided by your weight times 100, and weight includes non-fat things like bone and lean. Now, bone won't really change over time, but lean certainly can. Lean is not just muscle, it sounds like it is, but it's probably only 20-25%, maybe more, maybe less, depending on the individual. Most of lean is water. So, and water can go up and down 2 or 3 kilograms even in one day, and certainly between 2 DEXA measurements. So, you know, if someone loses some water, then your percent fat will go up just by the way it's calculated, the maths of it. So it's a bit variable, percent fat, and it doesn't always reflect accurately what fat is actually doing. So I use kilograms of fat. That's the raw data we get, and it's much easier to use fat mass as a way of judging where you're at and where if there's any progress happening or not. However, the absolute amount of fat doesn't tell the whole story. It needs to be adjusted both for size and also for sex. So females get to carry more than males. Those with a bigger frame over which the fat is to be spread get to carry more fat than someone that's much smaller in frame. So it needs to be adjusted for size and sex. So if we come down here, this is a 43-year-old male who is currently carrying 18.94 kilograms of fat at his initial scan. What we've done is constructed some categories, so lean, athlete, and healthy, overweight, etc. The numbers against each category will be different for different people based on the size and sex, as I said. So for this male, you know, I'm saying he shouldn't be carrying any more than 18.63 kilograms of fat to get into the healthy zone. So he's about 310 grams away from that at the moment. If, for example, he wanted to get down to the bottom of his green zone, then that number, the target would be 9.86 kilograms of fat, which is about 9 kilograms of fat away from where he is now. So that's a good way to do it, because that 9 kilograms of fat will not change. It's always going to be 9 kilograms of fat that he has to lose to get down to that point. Often people, if they use weight or percent fat as a way of judging progress or setting a target, then it can be a bit confusing, because often people can come back, for example, and lose 10 kilograms of weight on the scale, and sometimes only 5 of that is fat and 5 of it's lean, which is usually water. Other times people come back and almost 10 kilograms of the weight loss is actually fat loss. So it's impossible to predict. So having a target weight is problematic, because we don't really care about the weight. We care about the fat only, and if we assume that all the weight lost is fat, then that's wrong in most instances. So using kilograms of fat and tracking that is a better way to go. Just looking at the images here, what DEXA does is color code the tissue type. So blue is bone, red is muscle, yellow is fat. This is the first image that we saw, so the baseline one, 19 or thereabouts kilograms of fat. So you can see the yellow around the tummy there, so that's a bit of spare tire or love handle fat. We jump to the third image. This is when he actually reached the bottom of the green zone, which, as I said, normally corresponds pretty well with seeing no yellow on the fat on the trunk, and that proves to be the case here. So he did very, very well. He actually went even further and got down to 6 point something kilograms of fat, where virtually you don't see any yellow really covering the body at all. Doesn't mean there's no fat there, because he's got 6 point whatever kilograms of fat, but it's not thick enough to see. So that's very lean, not quite bodybuilding lean, but getting very close.